So Jim definitely has transformed hospitals because he's not just concerned with the delivery of healthcare. He's really concerned about the overall experience of patients, families, other physicians, all the staff members. He signals this with his involvement in numerous organizations, whether it's the Huntsville Hospital Foundation, the Madison County Medical Society, the American Cancer Society, the Leukemia and Lymphoma Society, the ALS Society. I mean, he's on more boards than we can list here. And so he's someone who's really committed to improving overall health care across North Alabama. He's probably the second best radiation oncologist in North Alabama. But all joking aside, I think Jim's superpower is his ability to communicate with people. So whether that's patients, staff, family members of patients, he's able to connect with people, make them feel comfortable, and explain things to them on their own level.
You know, he can't change who gets cancer. That is not something he can do, but he can change their experience. And he has worked hard, he and really everybody, his whole staff has worked really hard to make it a welcoming environment. And he does not even wear a watch during his clinic. His patients, if they need 30 minutes, that's what he takes. If they don't, that's fine too. But he wants to be there to answer every question, to give every option, to look at all the scenarios. He's a real people person, and he knows his patients aren't just patients, they're people, and they're people with families. His mother has had cancer, my dad and my mother too, so he knows that experience, and he wants to do everything he can to help his patients have a great outcome and just have as good an experience as you can dealing with something that life has thrown at you. Like I said, he can't change what has happened, but he can help mitigate how it affects you.
When Jim meets with a patient and they're going through such a stressful, scary experience, I think they leave the room knowing that he truly cares for them, and they leave the room understanding the situation and feeling like they've been heard and understood.
Well, he is genuinely interested in people. He just likes to hear their stories. And sometimes when he's talking to them, it's not even about what their treatment is. It's about, hey, what do you like or enjoy in life? And that's one thing that he has done. He found out a patient had a hobby like collected coins. Well, he went online and found a coin. He's like, well, let's talk about this coin. Tell me about this coin. And he would give it to them. Hey, you wrote a book. Let me buy the book. I'm curious to... He is curious about his patients, not just their treatment, but them.
I couldn't be more thankful to work with Jim. As I've mentioned, he's an excellent clinician, but he's also just a blast to be around. He's a lot of fun. He's somebody I trust and respect both personally and professionally. And Jim has many friends, but certainly I would consider Jim my best friend.